Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Infant and Newborn Nutrition. Introduction. Food provides the energy and nutrients that babies need to be healthy. Breast milk has all the necessary vitamins and minerals a baby needs. Infant formulas are also available. Infants usually start eating solid foods around 6 months of age. Check with your healthcare provider for the best time for your baby to start. This program will help you understand newborn and infant nutrition. It covers the differences between breast milk and formula and how to introduce solid foods. It also provides information on food safety. Breast milk. Breast milk has a lot of nutrients in it that will help your baby grow into a healthy and strong toddler. Breast milk also contains antibodies. Antibodies are special substances that help fight infections. The antibodies in breast milk help prevent your baby from getting sick with diarrhea, ear infections, lung infections, and allergies. In fact, there are fewer deaths and fewer illnesses in babies who are fed breast milk than in babies who are fed formula because formula does not contain antibodies. Babies who are breastfed are also less likely to develop certain medical conditions, such as type 1 diabetes or asthma. Breastfeeding also reduces the risk of obesity. Recent research suggests that breast milk has important fatty acids in it. These fatty acids help your baby's brain grow and improve cognitive skills such as memory, concentration, and logical thinking. Breast milk is also easily digested by the digestive system of the newborn baby. Formula. While breast milk is best for your baby, sometimes it may not be possible for a mother to breastfeed her newborn. For these mothers, infant formulas are another option. Infant formulas imitate breast milk and have all the nutrients the baby needs. Although they are similar, the components of formula and breast milk are not exactly the same. Iron-fortified formula is recommended for the first year of life. Formula is not as easily digested as breast milk. This means that a baby who is fed formula may need less feedings. Some women prefer bottle feeding because of the freedom it allows. A bottle can be filled with breast milk the mother has pumped and stored, or with baby formula. Bottle feeding makes it easier to feed your baby in public. Other family members are also able to feed the baby through bottle feeding. However, bottle feeding can take a lot of organizing with washing bottles and preparing the formula. Compared to breastfeeding, bottle feeding also makes it easier to see how much your baby is eating. This will let you know if your baby is getting enough to eat. Bottle feeding can be expensive compared to breastfeeding. You have to pay for the bottles and cleaning detergents. Mothers who choose to feed their babies formula instead of breast milk they pumped and stored will have to pay for the formula too.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Feeding your infant. Newborns need to be fed every 2 to 3 hours. Usually, healthcare providers recommend feeding babies when they show signs of hunger. Your baby may cry or make sucking noises to show hunger. Infants may also put fingers in their mouths when they want to be fed. If you are breastfeeding, your baby should be given 10 to 15 minutes at each breast. It can be difficult to know if your baby is getting enough to eat when breastfeeding. Your baby is likely getting enough to eat if he or she gains weight, needs a diaper change about 10 times a day, seems full, sleeps well. If you are feeding your baby formula, your baby will probably need 2 to 3 ounces at each feeding time. You can easily see if your baby is eating enough if you choose formula. Sometimes your baby will want to be fed more often than other times. This may be due to growth spurts. Continue to feed when your baby shows signs of hunger. Babies often need to be burped during and after feeding time. This is because babies swallow air when feeding. To burp your baby, you should gently pat your baby's back while supporting his or her head on your shoulder. You can also sit your baby on your lap and support his or her chin while patting your baby's back. Some people prefer to lay their baby face down in their lap. Be sure to keep your baby's head higher than his or her chest if you choose this method of burping. It is also important to keep your baby upright for at least 10 to 15 minutes after each feeding. This prevents your baby from spitting up. While spitting up a small amount is considered normal, if your infant vomits after every feeding, you should contact his or her healthcare provider. This may be a sign of a digestive problem or allergy. Solid foods. Before children reach age 1, most of their nutrition comes from milk. However, you should slowly begin introducing new foods when your baby is 4 to 6 months of age. Make sure to check with your infant's healthcare provider before starting any solid foods. The healthcare provider can make suggestions for your baby's diet and address any concerns you may have about starting your baby on solid foods. The first solid food for most infants is iron-fortified rice cereal. The cereal is made specifically for infants. Usually the rice cereal is mixed with some breast milk or formula. Let your baby smell and taste the food from a spoon. If your baby rejects the food, wait for a few days before trying again. While your baby is learning to eat solid foods, you should still provide the usual breast milk or formula feedings. You can introduce a fruit or a vegetable after your baby gets used to the cereal. Make sure the food you choose is finely pureed. If your baby doesn't like a new food, don't give up right away. It may take a few days for your child to try a new food. Also, start with only one ingredient. For example, you should introduce your baby to applesauce instead of apples and pears pureed together. You can introduce mixed foods after your baby has started eating single foods. Introduce new foods one at a time. You should wait for a few days or even a week before introducing something new. This also allows you to watch for any signs of food allergies. New foods should be given in small amounts. Children are more likely to try smaller amounts of new foods. Try introducing new foods again at a later date if your child didn't like them the first time. Children are picky and may like a food after refusing first. They may also like one food for a while, but later refuse it.
You can offer your baby juice around 1 year of age. Your child should have no more than 4 ounces a day. Drinking too much juice can lead to dental cavities, obesity, and even poor nutrition. Some families decide to prepare their own juice rather than buying it at grocery stores.
Table foods. By the time they are 8 months old, babies are usually comfortable with eating infant cereals and pureed foods. When babies are 8 to 9 months old, they should begin eating table foods. Just like solid foods, table foods should be introduced slowly. Start with one food. Wait a few days to a week before introducing something new. Also, watch for signs of an allergic reaction. Signs of allergic reaction include diarrhea, fussiness after eating, increased gas, rash. When babies are 8 to 9 months old, you should begin offering coarser texture foods and foods that require a little more chewing. You can buy baby foods that have more texture. You can also mash, cut up, or grind the foods the rest of the family is eating. Just make sure the food is soft enough. You should also cut the food into small pieces so your child doesn't choke. If your baby rejects foods that have texture, try mixing them with foods you know your baby likes. Also, begin by serving small amounts of the food. Never leave your baby alone while he or she is eating. Also, avoid foods that could cause your baby to choke. These foods include hard candies, hard fruits, hot dogs, popcorn, raisins, raw vegetables, white bread, whole grapes. You can give your child a baby spoon at this age, but it may take a while for your child to know how to use it. Usually around 9 months of age, children can try feeding themselves with their fingers. Foods to avoid. Some foods should be avoided in infants that are learning to eat. This section discusses these foods. Certain foods are known to commonly cause allergic reactions. These foods should be avoided when your infant is just starting to eat solid food, unless your baby's healthcare provider recommends them.
Some foods that commonly cause allergic reactions include eggs, fish, nuts, shellfish. Ask your healthcare provider about when and how to introduce these foods.
Some children may be at a higher risk for developing an allergic reaction. Your child may be at risk if at least one family member has asthma, eczema, food allergies. Symptoms of an allergic reaction or food allergy may include diarrhea, fussiness after eating, increased gas, rash. Severe allergic reactions may cause hives or problems breathing. If your child experiences these symptoms, you should seek medical attention right away. If your child has a severe allergic reaction to a food, avoid that food for now. Talk to your child's healthcare provider before you offer that food again.
Honey and regular cow's milk are also foods that should be avoided temporarily. Honey can cause an infection called botulism. Cow's milk does not have all the nutrients babies need and is hard to digest. These foods are not safe until after your baby's first birthday.
Dietary supplements.
Breast milk and formula contain the right amount of vitamins and minerals needed by infants, but breastfed babies need additional vitamin D. Infant formulas usually contain enough vitamin D. Your infant may also need an iron supplement. Talk to your child's healthcare provider about if and when to supplement.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Food provides the energy and nutrients that babies need to be healthy. Breast milk has all the necessary vitamins and minerals a baby needs. Infant formulas are also available.
Infants usually start eating solid foods around 6 months of age. Check with your healthcare provider for the best time for your baby to start. Your baby will begin eating table foods around 8 to 9 months of age. Table foods have coarser texture and require a little more chewing. Some foods should be avoided by infants who are learning to eat. Avoid feeding your baby honey, cow's milk, and juice for the first year of life. Ask your healthcare provider about the risk of food allergies and other foods to avoid. By introducing foods slowly, you can help create a well-balanced diet for your infant. This will keep your infant healthy and happy. Thank you for using Explain.